David Ankers, and I'm Urogynaecologist at Mid-Cheshire Hospitals. Bladder and bowel symptoms that affect huge numbers of people we see in clinic every day. So 1 in 2 women may have a prolapse, 1 in 3 have overactive bladder. And there's lots of different aspects to it that we would see patients for, and they affect people in all different age groups and all huge different varieties of patients that we see. Sometimes we would see people just have children within a year or so, and sometimes around the time of the menopause and after the menopause. So it affects different ages, and also it's got a huge impact on quality of life. We see people all the time with their symptoms that are significantly impairing their quality of life, and that impacts hugely on all aspects of life. So some of our management strategies are about improving that quality of life. It's about that function, which is really important, and it's really rewarding to be involved in this setting, really. So I've been involved for over 17 years in obstetrics and gynecology, and I found it the most rewarding aspect to it is seeing patients that you can treat and get some of their symptoms resolved over time. So we may have talked about pelvic floor physiotherapy that has a huge impact on overactive bladder, prolapse. Also there's issues regarding recurrent urinary tract infections, sexual dysfunction, and the time of menopause as well. So there's huge aspects to it. And pelvic floor physio and bladder training are crucial to a lot of that. And we work really closely with our physiotherapy colleagues in our pelvic health network. Also, we may use some tablet medications to help with urinary symptoms, and we work with our GPs to help with that. And also, HRT medication is really important at different times in life. So we work with our GPs and the team to help with those symptoms. Sometimes we'd go for operations and certain tests that we sometimes do to help see what's happening to the bladder, and sometimes that involves some filling the bladder and seeing what's going on in the overactive bladder or stress incontinence, and that makes it real different to what types of operations and surgery we may go forward with to help with outcomes as well. And all our outcomes are part of a national database, and we record our outcomes and we see patients afterwards to see what their outcome is. So that's really important. We also have urogynaecology specialist nurses to help with us throughout the whole process, because it is a journey, and it's about improving patients' quality of life all the way through.